Hello friends, today we are going to discuss about specific learning disorder, also called as developmental learning disorder. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. In this video, I'll be discussing about specific learning disorder, what is the difference between specific learning disorder, specific learning difficulty, and specific learning disability. What is the origin of specific learning disorder, diagnosis, differential diagnosis, and the neurobiology of this specific learning disorder. In this video, I'll be discussing about specific learning disorder, and I'll be using the short term SLD. SLD is an umbrella term for a group of neurodevelopmental disorders that are typically diagnosed in early school aged children, although it may not be recognized until the adulthood. They are characterized by persistent impairment, remember this word, persistent impairment in at least one of the following: either reading, writing expression, arithmetics, or the combination of the above. SLD are defined as a significant deficit in learning relative to the expectation based on the individual's age and intellectual ability, which cannot be completely attributed or explained by the environmental or psychiatric symptoms. That means we know children's academic gain or loss is directly dependent upon their health. If they have a good health, they have a good academic growth. If there is any problem in their health, for example, psychiatric disorder, neurological disorder, chronic medical condition, that will cause academic decline. Whereas in SLD, the academic decline should be directly attributed to this neurodevelopmental disorder called SLD. SLD is a potentially disabling condition, and it interferes with the child's adaptation at school and society. Hence, specific learning disorder also has been given a status of disabilities. That means it is also considered as specific learning disabilities. What does it mean? For the purpose of providing legal support and accommodation as per the law, it is considered as specific learning disabilities. To get these disabilities, following has been included across the world in various legislation and also by various names, such as oral expression, listening comprehension, written expression, basic reading skills, reading fluency, reading comprehension, mathematical calculation, problem solving, or mathematical reasoning. That means SLD has a status of disability at this point of time. But however, one need to understand the difference between the terms difficulty versus disorder versus disability. In terms of difficulties, every child, when they are learning, they will go through difficult phase. If provided with adequate opportunity in a good environment, this difficulty can be removed. But in spite of reasonable degree of remedial measures, if the child continues to have the problem, that is persistent problem is there, then we call it as specific learning disorders. But however, to become disabled, that means child is unable to participate in the school, in the society, then the law will come into place to protect the child. That is specific learning disability. Further, here, along with this specific learning disorder, there are many comorbid psychiatric disorders, neurological disorders, and medical disorders. That means there are dual diagnoses. There is SLD and also other physical condition. Both of them will impair or disable the child in academic growth. Hence, that is the word called as specific learning disabilities. It is a legal term clearly defined for a welfare measures such as accommodation, rehabilitation, remedial measure, and also reintegration, and to include the child in the current academics. That is the reason it will be considered as specific learning disability also. Let's define the specific learning disabilities as per the Indian law. The Indian law for the disability is Right to Persons with Disability Act 2016. In this RPWD Act, the definition of specific learning disability is it is a heterogeneous group of condition where there is a deficit in process of processing language, spoken or written, that may manifest itself as a difficulty to comprehend, speak, read, write, spell, or to do mathematical calculation, and includes such as conditions as a perceptual disabilities, dyslexia, dysgraphia, dyscalculia, dyspraxia, and developmental aphasia. This is a very complex definition, very difficult to understand, but easy to implement because SLD appears to be very straightforward and it will be seen as an academic decline in the schools. Let's look into the origin of this specific learning disorder. In 1877, Adolf K. was the first to identify reading inability and he called them as word blindness. A decade later, the Berlin introduced the term called as dyslexia. That means the first time the word dyslexia was introduced in 1887. Further, Marilyn Monroe in 1932 introduced the concept of difference between actual and expected achievement for assessment of SLD. That means the child's academic ability versus cognitive ability. If there is a difference, that means the child has SLD. Further, in 1937, Samuel played an important role in differentiating and introducing two concepts in SLD. He said that identifying that SLD children had average or above average IQ. That means he is the first person he said that SLD can be diagnosed only if the child has average IQ or above average IQ. If the IQ is very less, then it cannot be SLD. His learning deficit is directly dependent upon the child's cognitive ability. That means the child has intellectual disability. Further, introducing multisensory training for treating SLD. These are the two important Samuel's contribution for SLD. Further, the Samuel Kirk in 1961 defined dyslexia as an unexpected difficulty in learning one or more of the instrumental school abilities. He also introduced the term specific learning disability. He also viewed SLD as an overarching category of spoken and written language difficulties that manifested as disabilities in reading, that is dyslexia, or difficulties or disability in mathematics, that is dyscalculia, and writing, that is dysgraphia. However, in UK, the subject of this learning disorder started to appear in the policies in 1970, that is in health policies, in education policies. That means this acute dyslexia was covered under the Chronically Sick and Disabled Persons Act. The first time the legislation was introduced, and in this legislation, the SLD was introduced under Section 27. At the same time, this specific learning disorders made its way into diagnostic categories. It was called by various names. In DSM-1, it was called as chronic brain syndrome. In DSM-2, it was called as mild brain damage and attention deficit hyperactivity disorder, that is ADHD. In DSM-3, it was considered as separated academic skills disorder and ADHD. However, in DSM-4, SLD made a greater breakthrough. It differentiated reading, writing expression, and mathematics. And DSM-5, SLD can manifest in three major academic domains, that is reading, writing, and mathematics. That means the DSM-4 and 5 has a similar form of categorization. Further, the US Office of Education In 1977, regulatory definition of SLD was included as a cognitive discrepancy between higher IQ and lower achievement as a inclusionary criteria. That means even the discrepancy between the IQ and the academic achievement came into the disability definition. Further, the exclusionary criteria was also placed. They said that SLD cannot be attributed to other secondary causes such as psychiatric disorders, medical condition, or else emotional disturbances, or sensory disorders, difficult to hear, difficult to see, economic problems, cultural diversity, or for access to education. SLD shall reflect the inadequate response to the intervention. That means to define specific learning disorder, it should be persistent. A reasonable degree of intervention also fails. That means it should be very clearly a persistent problem of neurodevelopmental disorder. Further, it was came into response to intervention also planned. That means the SLD origin took into the intervention part also. Tier 1, Tier 2, and Tier 3. In Tier 1, it will be invariably a kind of mild SLD versus specific learning difficulty. A casual teaching at the school should be able to give remedial measures. Further, in Tier 2, classroom as well as teaching plus small group supplemental intervention. That means the extra classes, separate classes for the child, a small group focused intervention can be Tier 2. Whereas Tier 3, a child who continues to struggle in spite of professional intervention or else individualized intervention. That means to define specific learning disorder, it has to be intractable or difficult to treat in spite of the intervention. Before you diagnosed specific learning disorder, there should be an attempt for remedial measure. And if that fails, then only you'll be certain it is a disorder, not just a difficulty. Let's move into specific learning disorder. It is also called by various names such as word blindness, dyslexia, alexia, dyscalculia, acalculia, dysgraphia, or agraphia. Specific learning disorder in which the normal pattern of skill acquisitions are disturbed from the early stages of their development. There are three important types of learning disorders. One is dyslexia, dysgraphia, and dyscalculia. Let's look into the etiology-based classification of SLD. One is primary SLD. That means the academic decline is directly because of the neurodevelopmental disorder, not because of secondary psychiatric disorders. For example, if a child has ADHD, attention deficit hyperactivity disorder, if the child is unable to focus on study and constantly moving here and there, definitely there will be academic decline that cannot be attributed as SLD. Depression. If the child has depression, academic decline is known, but you cannot call it as SLD. That is secondary to depression. Anxiety disorder, separation anxiety disorder, substance use, autism, autism spectrum disorder, and so forth. Secondary psychiatric conditions which can mimic as SLD. Further, secondary to organic conditions such as stroke, encephalitis, meningitis, epilepsy, all these also can present as SLD. That means, although the SLD is a symptom, at present, the diagnostic category, it should be primary in cause. That means it should be directly attributed to the neurodevelopmental problems, not because of secondary psychiatric cause or secondary to neurological causes or any other medical causes. Let's understand the concept of specific learning disorder. This is the brain. Here in brain, we get inputs from various special senses, such as eyes, by reading, by hearing, and also by touching and feeling. These inputs are in the form of information. It is received in the brain, processed in the brain, stored in the brain. Once it is stored, it will be retrieved later and utilized. That is output. So, the brain, especially this language and communication, in the form of reading, writing, communicating, this process requires some cognitive skills, such as focusing attention and receiving the information. Once the brain receives the information, it has to be processed, understood, stored in a meaningful fashion. And then, in the later part, whenever there is a problem, this information is retrieved and utilized for solving the problem. So, this process of cognitive skill is very essential. That will be considered as reading, writing, and mathematical skills. So, these skills occurs in the brain of a human being because human beings have learned this language, and also the process of academics is only in the animal kingdom in human being. Hence, the SLD can be considered very specific for human beings. Let's look into the diagnosis. That is, I'll be discussing two diagnostic criteria. One is DSM-5, another one is ICD-11. Let's look into the DSM-5 criteria for SLD. Here, there are four important criteria for diagnosing specific learning disorder. The first criteria, here it clearly says the child or the adolescent continues to have difficulties at least in one of the following area for at least 6 months despite the targeted intervention. That means you should have given some intervention. In spite of that, the child continues to have one of the following area deficits. It may be difficulty in reading, difficulty in understanding the meaning what it has read, that is comprehension, difficulty with spelling, writing, difficulty in understanding the number concepts or the number facts or calculation, difficulty with mathematical reason. That means any one of them should be there for 6 months in spite of intervention. The second criteria is have academic skills that are substantially below what is expected to the child's age and causes problem in school, work, or everyday activities. That means the child's academic decline or academic skills decline should be below the child's expected age. Further, the third criteria should be the difficulty starts during the school age. That means early part of the school age. Even if some people don't experience the significant problem, it will be manifested in the adulthood when academic work and day-to-day demands increases. Fourth criteria is learning difficulties are not due to other conditions such as intellectual disability, that is mental retardation. Either there is a vision problem or hearing problems, neurological conditions, economic or environmental disadvantage, lack of infrastructure, lack of proper instruction, access to academics. Further, difficulties in speaking, understanding the language. Those cannot be there when you are diagnosing specific learning disorder. Hence, these four criteria for SLD, the diagnosis is made based on the observation, interviewing the child and the parents, family history, taking the school reports, that is teacher report, child's homework, child notes, if possible, the marks card, answer sheet of the child. All these will help you in making the diagnosis of SLD. However, neuropsychological testing may be used to help the find a best way to give a remedial measure and also for certifying for disability. But however, DSM-5 further goes into specifying the type. The first four criteria is to diagnose specific learning disorder. There are three important types. Impairment in reading, that is the first type. That is, there is a problem in word reading accuracy, further fluency, and comprehension. The second type is impairment in written expression, spelling accuracy, grammar, punctuation accuracy, organization of written expression. With impairment in mathematics is the third type. Here, the child will have difficulty in number sense, memorization of arithmetic facts, accurate calculation, and reasoning. Here, the DSM-5 gives complete freedom to code either the one or two or more can be coded, but all of them need to be specified. Further, DSM-5 also specifies the severity. Severity has been specified into three: mild, moderate, and severe. Mild means the child has some difficulties with learning in one or two academic areas, but may be able to compensate. Moderate means there is a significant difficulties with learning, requiring some specialized teaching and some accommodation or supportive services. Whereas severe, here the severe difficulties with learning affecting several academic areas and requiring ongoing intensive specialized teaching. It is based upon the remedial measures mild, moderate, severe is diagnosed. Let's understand this picture. Here you can see the reading, writing, and mathematical. These are the three important DSM-5 categories. In reading, there is a problem in fluency, that is rate, accuracy, comprehension, and also spelling accuracy is also considered as dyslexia. Whereas in written expression, dysgraphia, it is the grammar, punctuation accuracy, clarity, or organization of the written expression. That will be coming under dysgraphia. The dyscalculia is number sense, memorization of arithmetic facts, accurate or fluent calculation, and mathematical reasoning. So these concepts forms specific learning disorder under DSM-5. Let's move into ICD-11, which was recently introduced and accepted worldwide. Here, SLD is considered and new name has been given. That is developmental learning disorder. Specific learning disorder name has been abandoned. There are various reasons to abandon. The main reason being is there is no purer form of reading disorder, writing disorder, or arithmetic. Invariably, it is a combination of the problems along with psychiatric comorbidities. Hence, it has been given a new name, developmental learning disorder under ICD-11. If you look at the developmental learning disorder, it is characterized by significant and persistent difficulties in learning academic skills, which may include reading, writing, and arithmetics. Further, ICD-11 also clearly says that the onset should be in the early school years. Learning skills are below the expected age, not accounted for psychiatric illness or intellectual disability or any other medical condition. Further, this academic decline should not be accounted for economic or environmental disadvantage or lack of access to educational opportunities. Further, impairment should be there in individuals' academic domain and also occupational domain. Further, this developmental learning disorder has been subtyped. The first subtype is impairment in reading. Impairment in reading difficulties are manifested in reading skills such as word reading accuracy problem, difficulty in reading fluency, or reading comprehension. It is almost similar to DSM-5. Impairment in written expression. Here, the ICD-11 clearly says learning difficulties are manifested in impairment in writing skills such as spelling accuracy, grammar, punctuation accuracy, organization, and cohesion of ideas in writing. The other one is important impairment in mathematics. Learning difficulties with regard to mathematics are mathematics skills present such as number difficulties or number sense, difficulty in remembering the number facts, accurate calculation, fluent calculation, and mathematical reasoning. The next one is other specified impairment in learning. Here, learning difficulties are manifested in impairment in learning and performance of specific academic skills that are not adequately categorized by one of the above specifiers. Now, after understanding DSM-5 and ICD-11, let's understand what are the differential diagnoses for specific learning disorder. First and the foremost, borderline intelligence or intellectual disability, that is mental retardation, attention deficit hyperactivity disorder, oppositional defiant disorder, conduct disorder, autism or autism spectrum disorder, school absenteeism because of various reasons. It may be because of substance use, it may be because of medical condition, or else psychiatric condition. Various psychiatric illnesses, discrepancy between mother tongue and the medium of schooling, inadequate facilities of schooling, poor social support, hearing impairment, visual impairment, neurological disorder such as maybe myopathy, writer's cramp. So all these needs to be kept in mind. That means because of these various conditions, academic decline can be seen and it may be misdiagnosed as SLD. Why are we worried about this SLD? What is the burden of this specific learning disorder on our community? Why should we know about this? If you look at the United States of America, the prevalence is somewhere around 10%. However, American Psychiatric Association DSM-5, when they released, they reported the prevalence of SLD is somewhere between 5 to 15%. That is the huge number. If you look at the Indian studies, very important study was done by NIMANS, by Professor Shobha Srinath. The total prevalence rate of SLD was 12% in Indian population. It's not a small number. In another study done in South India, published in 2012, the SLD rates were 15%. Dysgraphia was 12%, dyslexia 11%, dyscalculia was 10%. Another study which was done in Gujarat, especially in primary school children. Here the dyslexia was 8%, dysgraphia was 7%, and dyscalculia was 7%. If you look at the another important study in Ernakulam district, here the prevalence was again higher rate, 16%. With regard to the prevalence of impairment, the reading impairment was seen in 12%, writing expression was in 15%, and arithmetic was 9%. However, you can see the prevalence rate is varying. Hence, there was a meta-analysis done in June 2022, published in Indian Journal of Psychological Medicine. In this meta-analysis, what was the report? This meta-analysis included 6 important Indian studies, which covered 8,133 children. This systematic review reported 8% prevalence of SLD in India. 8% is a conservative estimate. If you do a very strict systematic study, it will be somewhere around 10 to 15%. However, because of the study, because of the small sample size, subgroup analysis could not be done in this meta-analysis. To summarize, the prevalence of SLD, that is specific learning disorder, is one of the most common neurodevelopmental disorder. It falls somewhere around 3 to 10% in children. If you extrapolate this data in Indian population, if you look at the children's population at present, below 14 years is 26%. That means somewhere approximately 30 crore children are below age of 14. And if you consider 3 to 10% of them have SLD, that means we have a children somewhere around 1 to 3 crore suffering from SLD. My dear friends, it's not a small number. Let's understand why there is a huge variation. Variation somewhere between 5 to 15% in American studies, and in Indian studies somewhere they said that maybe 3 to 16%. What are those reasons? The first and the foremost, the SLD is based upon the standard deviation. If whether you have kept the standard deviation at 1.5 or else is it at 2. Depending upon if it is 1.5, That means the area under the curve, how many children are there and how many are left behind. So, depending upon the number of CA standard deviation, whether you are taking a strict criteria, is it 2 standard deviation or 1.5 standard deviation. Based upon that, the prevalence rate varies. Further, how do you define SLD? What is the case? How do you diagnose it? Whether you are doing this study in English language, English speaking children, or other local language and English medium they are using. So whether that plays a role in prevalence. Varying language tools. If you are using an instrument from English and then you are not done the cultural validation, and also if it is not adapted, of course you are going to get a different number. And depending upon the sample size, age group, urban versus rural population, English speaking children, there may be sampling bias also. Further, many of these instruments are not culturally adapted, and there is no universally accepted tool or instrument for screening and also SLD assessment. Hence, all these important points play a role in huge variation of SLD prevalence rate. Further, all the tools do not assess each subtypes of SLD. There will be inter-rater reliability should be done, and many of the studies have not done. Before assessment, reasonable degree of intervention needs to be done. That means a remedial measure has to be done so that when you are capturing specific learning disorder, you are not capturing difficulties. That is, specific learning difficulties you are not capturing. There should be some remedial measures has to be done. Unfortunately, we are not doing that. Other psychosocial problems, hearing problem, sight or ophthalmic problem, IQ, other causes are not ruled out in many of these studies. Further, one need to rule out other psychiatric comorbidities such as depression, anxiety disorder, internalizing disorder, or externalizing disorder. With this, now we will move on to co-occurrence and comorbidities. That means in children, whether SLD comes as a plain disorder or else it comes with other disorders also. If you take this SLD, that is specific learning disorder, it comes along with difficulty in reading fluency problem, spelling accuracy problem, grammar accuracy problem, organization accuracy problem, number sense, reading accuracy difficulties, mathematical reasoning, and fluent calculation. That means the child may not have only one problem with regard to SLD. Here, the child will have combination of above symptoms. That means if you look at the diagnostic criteria, the child may not have just a reading problem. Because the child is unable to read, the writing will be affected. Further, the child also will have difficulty in mathematics. And to summarize this, prevalence of specific learning disorder moves between from 5 to 15%. 80% of all SLD is dyslexia. That means dyslexia is commonest. 30% of them have comorbid emotional and behavioral disorders. Let's look into those comorbid condition. If there was a meta-analysis of 51 studies, which was recently published in 2022 in Journal of Child Psychology and Psychiatry. Let's look into this study. The title of the study was Language and Specific Learning Disorder in Children and Their Co-occurrence with Internalizing and Externalizing Problem. In this review, they clearly said children with SLD have higher internalizing and externalizing disorders than their peers. That means compared to control, SLD had more of internalizing disorders and more of externalizing disorders. Children with language disorders had more internalizing disorders when compared to dyslexia. That means a child who is unable to express language disorder invariably will have internalizing problem. Hence, that may be the reason. If you look at the comorbidities, the internalizing problem with SLD usually will be invariably like depression, anxiety. However, there are maybe externalizing problem like attention deficit hyperactivity disorder, that may be a comorbidity. Because of this depression, attention deficit hyperactivity disorder, along with SLD, there will be school dropout. And once they are out of the school, they'll become invariably having conflict with law. Some of them may develop mental illness, substance use, suicidal attempt, delinquency, and ODD behavior. That means SLD, 70% of the children will have other comorbid conditions. That means SLD does not come alone. Here, comorbidity is the rule. That means whenever you see a patient with SLD, 70% there is another diagnosable psychiatric condition. Let's look into this SLD and suicide, which has been rarely seen. One of the study done by Fuller in 2017, they clearly pointed out that adults with SLD were found to have 46% higher odds of having attempted suicide at some point of time in their lives, even when a variety of potential confounding factors were controlled. That means an adult with SLD, there is a high possibility they are going to attempt, and death by suicide is common. If you look at the Shah et al., that is in 2019, published in IJP, they looked into various comorbidities. Behavioral and emotional were 30%, ADHD were around 10 to 60%. Commonly, it is also seen that ADHD and the difficulty along with SLD is 20 to 40%, conduct disorder 6%, depression 33%, anxiety disorders varied between 20 to 30%, autism spectrum disorder 6%, language disorder varied somewhere around 55 to 70%. Invariably, if you look at all these disorders, comorbidity is the rule that you need to remember. Let's understand the relationship between SLD and psychiatric illness. There was a study done in Greece. This was a retrospective study of 835 cases who were diagnosed as SLD in their childhood. And also, they had some co-occurring mental illness. They looked into their outcome and they came up with this hypothesis, that is, Victoria and his colleagues. They said that neurodevelopmental disorders, either SLD as a phenotype, which leads to mental illness in future, or else the child is going to develop mental illness, hence he has SLD, or else the child has SLD, hence he is prone to develop mental illness. And they gave an hypothesis, and also it has a very important implication. If a child has an SLD, should we intervene? By this intervention, can we prevent mental illness in future? That is the question they have raised, and we need to answer in future studies. Let's look into those risk factors of specific learning disorders. Male gender, prenatal care and mother's health plays an important role. If there was no antenatal care, if there is a poor natal care and poor mother's nutrition, if there is a labor complication, that means during the childbirth, if the child has asphyxia, or else Afghar score is very less, minimum 5, that means the child is having some brain damage, low birth weight, preterm birth, maternal education, congenital anomalies, family history of mental illness, family history of SLD, that means genetics also play a role, chronic illness in parents or chronic illness in caregiver, chronic illness in childhood, socio-environmental and familial factors, and language delay. These are the various factors across various studies. They have identified that these are the risk factors to develop specific learning disorder. Let's look into the neurobiology of SLD. The recent advances in neuroscience technology as well as development of innovative research design has enabled the scientists to understand and employ divergent methodologies such as genetic analysis, neuroimaging, pathological analysis of the brain tissue, of autopsy, neuropsychological evaluation, activation during imaging studies, yielded highly convergent conclusion telling that there is a neurobiological etiology. That means there is a noise in the brain. It is completely different from the control that is normal children. That means there is neurological basis, maybe neurodevelopmental in reason. That is the reason the neurobiology of SLD is getting evolved. The possible neurobiological etiology at present indicates towards the complex interaction between genetics, environment, and developmental abnormalities have been implicated at this point of time. However, I'll be doing a separate video on neurobiology of SLD. Now, let's understand the cost of specific learning disorder to a community, to a child, or to the family. A cross-sectional study was done in Mumbai, and the calculation of cost of SLD was calculated on the family. They divided the cost into direct cost, that includes both medical cost and non-medical cost. Indirect cost, what is the wages of the parents for not going to the job, taking the child for the child guidance clinic, or going to the school, sending the child for tuition, buying some digital technology to train the child. They are considered as indirect cost. Another one is intangible cost. That means this is the cost where various people will offer that if you come and take training with us, this is the amount, one time payment. That is the intangible cost which has been considered by the authors. The results of the study was stunning. The parents reported, and also the analysis showed, per child, the cost per annum is 90,000 rupees. And in dollars, it is $1,150. It is not a small amount for an Indian population. That means child not only has to go to school, parents not only have to pay the child's school fees, now they have to spend 90,000 per year for SLD remedial measures. A similar study was done in UK. This was done by the All-Party Parliamentary Group of Dyslexia in 2019. The study was called as Human Cost of Dyslexia. Here is very specific to dyslexia. A study done by British Dyslexia Association reported that in UK, parents spend somewhere around £1,000 extra per year because of the child's dyslexia. £1,000 is almost again similar to 90,000 per child per annum in India. What are the costs which has not been estimated? The cost which has not been accounted is if the child SLD is not addressed, school dropout, if the child is out of the school, delinquency, conflict with law, breaking the law, cost towards securing the child back to the community, rehabilitation of the child in conflict with law, cost of psychiatric illness, such as treating ADHD, substance use, depression, anxiety disorder. We have not costed the suicidal attempt, death by suicide, unemployment because the child did not continue the studies, and the disability allowance for lifelong. These are not accounted. All this clearly indicates that SLD can cause a huge exchequer on the society. Intervention needs to also require trained human resources. That means special educator should be available, and the special educator should be invariably 1:1, or else a child, 2 or 3 childs may have one teacher or one special educator. More than that, it will not be effective. Further, the resources required for accommodation and remedial measures, that has not been calculated properly. Children with SLD who do not receive intervention can be a high cost to the society, family, and on themselves. That means SLD is not only a public health issue, but also a financial issue for any country, especially in India, where we are going to have SLD children, somewhere around 1 to 3 crore children having SLD, and we don't address this issue, we will be paying a huge price in the near future. To conclude, my dear friends, SLD is an umbrella term for a group of neurodevelopmental disorder, and it is a heterogeneous disorder. That means SLD having subtypes of reading disorder, writing disorder, or else mathematical. Those heterogeneity within the disorder is also seen, and also comorbidity along with other psychiatric condition, neurological condition, and medical condition is seen there. And all this will come a huge price not only on the society, on the family also. Hence, the specific learning disorder often improves with treatment, but however, it continues to persist in a less severe form in the adulthood. I'll be discussing about the treatment, remedial measure, assessment in the next video. Thank you very much for your valuable time. Stay safe.